It's disrupting people's health care, which will probably have fatal outcomes in some cases.
And new at 10, fallout from a healthcare insurance dispute. Legacy Health and insurance provider Regence have parted ways after the two could not reach an agreement on a new contract. Thank you for joining us tonight on the 10 o'clock news. I'm Rielle Creighton. This dispute leaves more than 100,000 patients scrambling to find a new provider. Fox 12's Vince Ibarra spoke to one family impacted by this move. He's live now in Beaverton with how they are hoping to create a change. Vince.
Well, Rielle, it was a big shock when the two medical companies ended their contract with one another. The mother I spoke with says she's now worried about her family receiving proper health care now that Legacy is out of network, but she adds she is not going down without a fight. A healthcare insurance nightmare.
The actual physical and mental health impact that this has had on me, losing sleep, interrupting my work.
Melanie Bobbitt, a Portland resident, says her family is living in uncertain times. She was already facing mounting medical expenses from care through Legacy Health when her partner received a notification his insurance plan was ending on April 1st.
It's a disaster. It's actively imploding. What I'm dealing with both my small child and my partner is a catastrophe.
After about 6 months of negotiations, Regence and Legacy Health couldn't reach an agreement on reimbursement rates, ultimately ending their contract for roughly 150,000 patients insured through Regence. Officials say the rising cost of operating expenses is a problem.
The last thing we want is anyone to delay care. So we are encouraging them to apply for continuity of care with Regence or their other Blue Cross Blue Shield health plan.
Both Legacy and Regence say they're open to continue negotiations. Regence officials tell Fox 12 they've set up a dedicated customer service team ready to assist patients needing help. As the uncertainty of care lingers over Bobbitt's family, the mother of two says she plans to do all she can to create change.
That's really low. Yeah, it seems like that could be fixed. Yes, exactly.
Bobbitt's neighbor, Mary Henrich, has worked with Healthcare for All Oregon. The organization aims to provide universal health care for Oregonians.
Some of us who tilt on windmills and really say, can't we do better than this? And I do it for my grandkids, because ultimately, the way it is now, it will collapse.
Henrich says Healthcare for All Oregon plans to meet with lawmakers in September about the state adopting universal health care. And Rielle, Healthcare for All Oregon says they plan to host several town hall meetings across the state in the coming weeks. We'll have that information on our website. For now, live in Beaverton, I'm Vince Ibarra, Fox 12 Oregon.
A really difficult situation. Vince, thank you.